I'm going to have Wendy Carrillo make the last comment from committee, and then we'll give it back over to you for any comments.
Thank you, Madam Chair, and I feel it necessary to also give a disclaimer on behalf of my colleague from South LA who will not get law enforcement involved in his situations moving forward. But I do agree with a lot of his sentiment. I think a lot of us have personal experiences when it comes to lack of quality of health care, lack of insufficient quality health care, over like incredibly burdensome cost associated with health care. A lot of folks in my community, Assembly District 52, which includes East Los Angeles, Northeast LA, rely on the emergency room, and that's already incredibly costly. A lot of community clinics are becoming less and less available in our community, less and less doctors and nurses, affordability of healthcare. All of these things are true. And I really just want to bring into the space a gentleman that we lost, Addie Barkin, who has been at the front lines of Medicare-for-all for many years. And while we may discuss issues related to healthcare at disproportionate ages, Addie was 39 when we lost him, and we lost him to ALS. And he was a family man, husband, father, and a staunch advocate for healthcare. And we know in this movement so many people that we continue to lose because of just an inability to receive healthcare in time or preventative. I want to thank the author for all of his diligence and hard work and having the meetings necessary at the federal level to get the federal waiver to even begin this conversation as to what it would look like. And I think it's important that we recognize all the work that's being done across the state and across the country. I completely, want to say respect the opposition and their point of view, but at some point in all of our lives, regardless of who we work for, or how much money we make, or where we are in life, we will know someone that is impacted by the lack of healthcare coverage or good quality healthcare, and we will know someone that is going to go bankrupt because of their high cost of bills. We know someone that's going to lose their home, lose their livelihood, lose their job, lose everything they have because they are trying to live their life with a disease, an illness, a family member going through cancer. We've heard the stories, and there are millions of them across the country. I want to thank the advocates that are here. Some I know are here from Los Angeles and various other places across California for their continued advocacy. Some constituents of mine who are in the room or are watching back home and couldn't make the trip up here. It takes effort to come up here and have 30 seconds or 10 seconds of testimony, and to really commit any free time that you have to fight for healthcare, and not only fight it for yourself and for your families, but fight it for every person across the state of California, because that's who you're fighting for, and that's who the nurses are fighting for. So I'm proud to be a joint author, proud to continue to support the policy in a variety of different ways for the past few years, continue to put pressure on the federal government to really move forward with the promises that were made during campaigns, and promises that were made here to the 40 million people that call California home. Nothing is ever perfect. I think the conversations related to healthcare in the state are critical. We know that the state of California is coming with more and more double seniors at the same time. Lack of, again, as I'll mention, lack of professional healthcare personnel to take care of our communities. The more that we work on this, I think gives us in a better space, and more people are supportive of the work that is being done. There's a lot of work to be done, but I think we're headed in the right direction. And while I think policy committees are always hard, it's always harder to present and sit with your opposition and try to come to common ground and try to really tell the stories of everyday people who are suffering and who really want us to do what's right for them. And so I'm happy to be supportive of the bill and continue to move the conversation forward. Thank you.